Greetings and welcome to Sinclair. Today, my name is Jim and I'm a behavioral health therapist at Sinclair. And today we're going to be discussing anxiety, a common issue which folks that come to Sinclair often present with. What can you tell us about that? Maybe perhaps you could introduce yourself.
Yeah, my name is Jonna Trexler. I'm a PA student from Chatham University doing my psychiatry clinical rotation here at Sinclair. This is my last week, so I'm really excited and honored to do the last podcast that I'll be participating in with Jim.
You were discussing with me earlier about at times you have a little bit of anxiety, and most people in their life certainly do. Tell me when that becomes an issue for people.
Okay, so anxiety, generalized anxiety, I would say, starts to become an issue when it starts to invade areas of their life and compromises areas of their life. So what do I mean by that? So when it causes them to lose sleep, when it causes them to not be concentrated on the task at present, when it causes them to feel fatigued or tired, overworked, really irritable, when those start feelings and moods and things start to invade their way of life.
Constant worry.
Yes, constant worry.
And you're in the medical field. What type of issues would we look at to determine whether anxiety may be caused by some other outside influence?
So, what can you elaborate on that question?
Sure. What type of a medical condition could mask anxiety? Could just make anxiety appear in an individual?
Oh, so if you're talking about other medical conditions that could be causing the anxiety versus an outside environmental stressor, it could be things such as thyroid conditions. So hyperthyroidism could possibly trigger that feeling of anxiety. Other psychological conditions as well could trigger the anxiety. So anxiety could come in a packaged form with things like panic disorder, PTSD, major depressive disorder. Could also come from just having high blood pressure, things of that nature.
When a person comes in and presents with anxiety issues, what other screening issues would you look at, such as factors in their life, such as let's say substance use?
So yes, like past alcohol use, drug abuse, also past history of some sort of sexual abuse or emotional or mental or physical abuse, and things of that nature.
Well, sure. And what type of environmental factors do we look at? I know here at Sinclair we take a holistic view of a person, not just a particular symptom. When we look at things like nutrition, we look like sleep patterns. What are environmental? What their work? What type of their interpersonal relationships?
Yes. So basically, their priorities in their life. So their work stressors, their tasks at work, their relationships with family, friends, boyfriend, girlfriend, husband, wife, spouse, partner, children, siblings, their extracurricular activities, so things outside of obligations, so sports or even finances can play a role, especially in today's society.
Well, generally what we look at when an individual presents with anxiety, we look at three different things. We look at intensity, we look at frequency, and we look at duration. And we look at what type of an impact or what type of dysfunction is it causing that person in social activities, in their educational activities, interpersonal relationships, work. Um, so what have you seen here at Sinclair that with individuals with anxiety issues? Tell me when you sat in with Dr. Chaudhry.
So when I've seen patients that suffer, from generalized anxiety, I see them, on a full spectrum of emotion. So they could come in and be very tearful, emotional. They could come in and be okay, but have that underlying worry, constant worry. So for the most part of their day, and that's pretty, true across the board, whether they come in, in an emotional state or not. A lot of racing thoughts, preoccupation with certain thoughts that are causing this anxiety, restlessness. They can't sleep. They're having trouble sleeping or falling asleep or staying asleep. They have to take off from work because they can't go in with these racing thoughts. And a lot of times these patients come in with a spouse or a loved one or another supporter of them, just for that support, and then the outsider's outlook
Excellent.
on the anxiety.
I'll throw this one out to Miss Caitlin. When a person comes in with anxiety issues, they tell you they can't sleep. They tell you that they're worried all the time. What type of physical manifestations does a person exhibit with anxiety?
With anxiety, it depends if it's generalized anxiety or an acute panic attack or panic situation. A lot of times we've talked about this fight or flight response that our bodies have when we're on this, very overextended mode of emotions. So when they're coming in with an acute panic attack because of anxiety, a lot of times we have a racing heartbeat. We can be tremulous, sweating. We can have rapid heartbeat and breathing issues. Even headaches can occur. And a lot of this stuff is having a lot to do with what's actually being released in our bodies. Cortisol is something that everyone has in their body that gets regulated through our system, and cortisol is that feeling that it causes that feeling of almost an adrenaline or hyper type of state. So if I saw a bear walk through the room, my cortisol level would go immediately up because I'd be anxious and fearful, and that's kind of how our body responds. We into that fight or flight reaction. But that's kind of what's going on as well when somebody's having a panic attack. So their body is constantly getting that increased blood pressure, rapid heart rate for an extended period of time, and that when that goes on consistently and becomes more of a generalized anxiety disorder, people actually, can get physically tired from this, and they might even coming in presenting and saying, I've been going to sleep I've been wanting to go to sleep at 7 or 8 o'clock at night, and a lot of times there's other reasons for that, but a lot of times when we're having these racing thoughts, very anxious about something, that cortisol level is constantly increased in our bodies, and we're having that high blood pressure, rapid heart rate. Your body gets physically tired from managing that constant overdrive, that you physically feel tired at the end of the day, and that's a very real symptom that happens. I think sometimes we just feel that we might be depressed or whatever, we're trying to maybe hide from something when we go to sleep early, but in reality there's a definite physiological component that goes on when we're living in this high anxiety state for long periods of time. Our bodies just can't function well, when we're under that significant stress. And it can even lead to heart problems and things like that if it's not managed well enough. That increased blood pressure that we have from the cortisol and the anxiety states can lead to other problems down the road with, even conditions with your heart and, other symptoms like that. So it really is important. We always say the mind and body are so vitally connected, and, just remembering that, because even though there's something emotionally or anxiety provoking going on in our minds, it's physiologically affecting our bodies as well, and it's important to, make that connection, because we need to kind of get to the root of the problem. So people might be saying, oh, it feels like, I have a heavy chest or something like that, and that can be completely anxiety related, as opposed to only a heart problem or things like that. So it's important to recognize that your emotions might be, playing a big part in your physical symptoms, like stomach upset and things like that, that I think it's important to be aware that those physical symptoms can occur with, anxiety
You mentioned
states.
racing thoughts earlier, I think, which is a commonality that a whole lot of people share at least some point in their life.
Definitely.
And when it gets to the point that it interferes with your life functioning, such as it takes a whole lot of energy to worry that hard.
Yeah, exactly. It takes a lot of energy. Your body's just not, our bodies can't keep up with that racing, constant chatter in our brains. And, I think that's kind of where the mindfulness aspect comes in, at least from our practice, kind of using we like to call it a Teflon mind, where we, say that when these thoughts and things come into our brains and we're recognizing that and having these racing thoughts, to use that Teflon mind and just kind of recognize that they exist and then letting them go, because we just can't keep up, to be in that constant state.
Perhaps Jonah could share with us some of the Psychiatry modalities that we offer here to deal with people with anxiety issues.
So we use, like she said, the Teflon mind. So having those thoughts come in, and I've had, several of our patients here at Psychiatry give me different illustrations as far as how they view the Teflon mind. So a lot of times people use the wave ocean illustration, where they have their thoughts come in like a wave, but then retreat and have them standing on the sand. And then, they'll come in the mind and then be sucked out. Other mindfulness aspects would be just being in the moment, focusing on the one task at hand, and then moving to the next one. So enjoying what you're doing, whether it's eating, showering, cooking your meal, or making your bed, doing that. And it's actually proven to show that if you focus on one task at hand versus trying to multitask all at the same time, you actually get things done in a faster manner.
And some of the things that you've participated in here at Psychiatry, such as the nutrition classes, the yoga.
Yes.
Could you share a little bit about that?
About twice a week, we do have two different yoga instructors come in to do 1 to 1.5 hour sessions of yoga. And yoga practice it can be very, very different. So the yoga we like to practice here at Psychiatry is based upon solely your breathing and being in the moment, the mindfulness. So it's not, physically extensive or, super aggressive yoga, but it allows you to, Dr. Chaudhary usually opens up the practice with, metaphorical lesson, and then we kind of practice that through the movements of yoga and the stretches of yoga and dwell on that moment and that lesson that he opened it with. And then the nutrition classes, we usually do those, we incorporate the nutrition, well, every day here, but I think it's the first Wednesday of each month that we do the nutrition classes, and we focus on how nutrition comes into play as far as your moods and the health aspects of that. And then also on Tuesday mornings we have a registered dietitian come in and cook us breakfast and do a little nutritional nugget on how certain nutrients in those foods can affect our well-being.
So what you're saying is when things aren't right up here, things
Yes.
aren't right here. And when things aren't right here,
Right, this
things
is
aren't
our
right
second
here.
brain.
And what Caitlin was referring to early was emotion regulation and the wave. At Psychiatry, we take an acceptance. And acceptance is not resignation, that the way it's always going to be. Let's use that wave example. We're kind of taught that when something attacks us, let's say an anxious thought, that we fight back. Well, quite often that doesn't work because it brings a whole bunch of its friends with them. So what we do, if you stand, let's say Caitlin, you've been to the ocean. If you stand up before a big wave and you just stand there like this and it comes, what's going to happen to you?
You're going to get knocked over.
And so what we deal with here at Psychiatry is emotion regulation, acceptance. Now, Caitlin, let's say that you were out there and this big wave was coming, and you let yourself loose, and you let your arms out, and you
rode the wave in. Yeah, fighting with those anxieties takes more energy than it does to be aware of them and kind of roll with it, like you're saying,
Well, some of the things is some people believe that if I worry real hard, I'll solve the problem. Well, worry doesn't solve anything. So there's different types of stress. There are different types of anxiety. There is positive and there's negative stress. A positive stressor would be you going to your next
clinical rotation.
Yes, that's a little bit stress. However, you referred to me earlier as that's an adventure.
Yeah, it is.
You shift your perspective.
Yes.
And it's like Caitlin, when a oil light comes on in your car, that causes you a little bit of anxiety.
I think my gas light's actually on in my car right now. But yeah, now I just have to sit there and think, well, I hope I have enough gas to get to a gas station when I leave here today, but at this current moment, there's not anything I can do acutely right now to fix that problem, and that's just kind of the point of what we're getting at, is recognizing that maybe that there is something that's stressful going on or something that's anxiety provoking, but recognizing that you can eventually build the skills to handle that anxiety with rationality as well, and just kind of recognizing doing what you can in that moment and being more of kind of problem solving and good to yourself versus battling with yourself and causing that emotional and physical exhaustion.
Motivation for positive change. And that's certainly why we look at, because here at Psychiatry, we have a firm belief that every individual has a vast potential for understanding themselves and the problems, and the answers are inside you, and we'll be happy to assist.
And I think one other thing I just want to touch on before we finish up, we talk about anxiety and things like that. I know I didn't get to stay for the whole talk today, but we talk about it as, a generalized anxiety disorder and things like that. But in reality, every human being has anxiety-provoking situations in their life. It's not, yes, of course, we have come to a point that we diagnose it as something. It's that we can, for DSM criterias and things. But ultimately speaking, everything that we practice and preach and talk about here, it's just for the general knowledge of public, and if you happen to have something you're struggling with, then that's okay too. But everybody has anxiety at some point. I had anxiety on the way here because I was in traffic and I was late. People every day have anxiety-provoking type of things, and to just recognize that this is a part of life, and it doesn't have to define you as a disorder, but more so just kind of how to live and manage these anxieties in a healthful, mindful way.
And before we end for today, I'd like to wish Jonna the best as she rides off into the sunset.
Thank you.
And as Roy Rogers would say, happy trails until we meet again.
Thanks, Jim. Okay. To find out more from us at Psychiatry, you can visit psychiatry.com, subscribe to Psychiatry video on YouTube for more videos, and follow us on Google+, and join us live on Mondays around noontime, so you can ask us your own questions for us to answer during our discussions. Thanks.